Welcome to the Daily Dose of Derm podcast, your go-to podcast for all things dermatology. I'm Dr. Mohiba Tareen, a board-certified dermatologist and the founder of Tareen Dermatology. Join us as we dive into the fascinating world of skincare, beauty, dermatologic treatment, and how to enter the world of derm. Whether you're a skincare enthusiast or an aspiring medical professional, this podcast is your daily dose of knowledge and inspiration. Get ready to uncover the secrets to healthy skin and discover how to make a meaningful impact in the field.
Hello, everyone. My name is Shihab Adam. I am your host for the Daily Dose of Derm. I operate here as a medical assistant and supervising surgical assistant here at Tareen Dermatology, and I am sitting here with the owner, the founder, board-certified dermatologist, Dr. Mohiba Tareen. Dr. Tareen, thank you so much for being here.
Thank you for having me, Shihab.
Awesome.
I'm honored to be with you.
Absolutely, absolutely. So just to kind of begin and just start off, could you tell me a little bit about your background, why you becoming a medical provider, becoming a dermatologist? Where did that all kind of come from?
So I love taking care of people, and that translated to a desire to become a physician. I come from a very long line of doctors. My grandfather was a doctor. My parents are both physicians. So that's kind of just in my DNA. Growing up, my mom is an internal medicine doctor, so that means she takes care of the whole person. My dad is an oncologist, so that means he takes care of cancer patients. And my parents were really adamant that they wanted me to be in a field that encompasses both prevention, follow through, seeing patients of all ages. And that's what dermatology is. I'm so excited to tell you why we love dermatology.
Yeah, no, absolutely. So what was the process of becoming a dermatologist? So after rotations, kind of walk me through that. I mean, how did that really?
So to be a dermatology MD medical doctor or DO, doctor of osteopathy, it's a long road. So, high school, college, I actually did a double major in comparative religion and biology because I really love learning about people. And I think we'll talk about that later, how that has allowed me to take care of all walks of life with people. So college, then you have to be at the top of your class to get into medical school. So you have to take the MCAT, the medical college admissions test, and did pretty well on that. Then I went off to medical school. So medical school is a 4-year process. I did medical school at Michigan in Ann Arbor. And dermatology is a very competitive specialty. I'm not going to lie. Many people want to be dermatologists, and you'll learn why. It's the best. So when I was in medical school in Ann Arbor, and this differs based upon the medical school that you go to. I had to be at the top of my class, lots of grades, lots of exams. There are step exams that you do. USMLE step 1, step 2, did pretty well on those. And then based upon that, and my interest in dermatology, then I got interviews in dermatology, and I interviewed across the country, and I chose Columbia University in New York City.
Incredible! Oh my gosh! So you're through medical school. You're in dermatology. You're in it now. How did you segue into, okay, I want to open my own practice? What kind of made you go into that?
So I did my residency at Columbia. So I'm, doing my 4 years of dermatology. Loved all of it. The medical, the surgical, the cosmetic. Loved it all. I had a chance to do what's called a fellowship in dermatology after. Not everyone does a fellowship. There are a few fellowships. There's pediatric dermatology. So you finish your dermatology residency, and then you do either pediatric derm, surgical derm, cosmetic derm, dermatopathology, where you look under a microscope at slides. So I elected to do what's called a procedural dermatology fellowship. That's where we do cosmetic and surgery. And surgery does look at a little bit of slides. So it kind of is also doing everything.
Just everything almost.
And then I worked at a practice, and I really espouse that of other young dermatologists and other young doctors. I worked at several different practices before I started my own practice. So that's really just like taking the best of everything and putting it into your own little mix.
Right. No, and I imagine, through that, you're able to learn all the nicks and crannies of how does this practice operate. And it can't be easy, beginning the process and establishing, ground up, making your own practice. What challenges came up? There had to have been many, right? It's new foundations.
So many. Again, it's like starting a business. Like, people start Subways, people start McDonald's. I started a medical practice.
There we go.
I'm really lucky to have great role models. So both of my parents have their own independent medical practices.
Amazing.
So,
Yeah.
and they came from India. They were immigrants from India.
Right.
Like every immigrant tells you they had $1 in their pocket when they
Yep,
came.
yep, yep. And I
You know
know a
about
lot
that,
about that.
Shihab,
Yeah, my
right?
family's from Sudan, and so yeah, I completely understand that. Generational, immigrants and growing up in the West. So,
Right. So our parents came from other countries, and my parents were able to start successful practices themselves. So I said, if my parents can do it, I'm educated in America. I, come from a background where I can take some chances.
right.
So we started. It was really nice. My husband is a doctor too. He's a urologist. So luckily he had a steady income because, like, in the beginning, when you start any business, you're always in debt. You don't have any money.
Mm-hmm.
So luckily, we had some money coming in with that.
Right.
But the challenges were, nobody knows about you. They,
Mm-hmm.
they think that you're just,
Right.
some kind of crazy person that
Right.
just hang
Right.
up their own shingle. But,
Right.
so in the beginning, you're like, I have great skills, but
Yeah.
nobody comes to you.
Right.
And you
Right.
got a lot of debt to pay back, Shihab.
I know. I'm not looking forward to it, but I know it'll all pay off in the end. So
But the
I'm not too
joy
worried.
is that it is all yours and you can
Right.
craft it. I mean, we'll talk about this. I just want my patients to be taken care
Yeah.
of like family. And I think that you see that. We know our patients, don't we?
Absolutely. If there's one thing I've truly taken out of just being with you, having the honor to just work with you, that is how I've cultivated my own way. I just treat patients. I go about going. I'm going to carry out that throughout my entire career, and I truly grateful and thankful just having the opportunity to work with you, and to just teaching me that has been core. And so just going back into just this beautiful establishment, Tareen Dermatology, all these clinics we have now and all the people we've been able to help, what are now looking out, what are now some of the long-term type of goals at this time, right? You're kind of in the groove of things, right? We have, all these successful clinics now. We have a lot of other medical providers now that are, here to help. But do you have any visions for long-term
My,
goals for the clinic? And
excellent question. My goal is that we call it, and this sounds cheesy, we call it the Tareen way, don't we, Shihab?
yeah,
What is the
I've heard
Tareen way,
that.
Shihab?
Oh my gosh.
You bring it
What
every
is
day.
it? Is there an actual phrase for
There's
it?
actual, the phrase is you treat every single patient how you would want your grandmother to be treated.
That's right. Yes.
You treat them not like you want your best friend. You want them to treated like your grandmother, with respect, but with love. So my legacy is I want a cadre of medical providers through Minnesota, through the Midwest, that will treat every single patient with respect, with love, with dignity.
Absolutely. No, I love that. Absolutely. Okay, so obviously it's not all lovey. It's not always sunshine and rainbows, and especially just being in the medical field, being in dermatology. What are some of the worser types of things in dermatology? Are there things that you kind of
The hard thing is, the most difficult thing I think for me, Shihab, is that there are a lot of really high deductible plans, a lot of people who unfortunately cannot afford their medical care. Like, for example, this gentleman with the skin cancer on his chest, he kind of delayed his care because he has a $7,000 out of pocket. And now, poor thing, is going to have this massive hole in his chest. So that's not something we can ameliorate, right? That's the medical system.
Right.
So I wish dermatology was viewed more in a preventative light. So they've done a study. It costs, a couple $100 to biopsy a mole. It costs $1 million a year to treat a melanoma, and the patient may die. So, the actuaries and the insurance companies have figured out that dermatology really does save money.
Right.
One thing I struggled with when I first started was that, patients would always in the past they'd be getting these cysts and like small skin cancers treated in the operating room, Shihab. And anytime you go to the operating room, it's going to cost you $5,000 to $10,000.
Right.
And I would do it in the office for $500 total.
Right.
And like still the insurance company wasn't, reimbursing us and things like that. Like they just don't see the value of dermatology.
That sounds, yeah, I guess I never thought of that aspect, especially when you're beginning and running your own practice, right? Just all the nicks and crannies of, just dealing with insurance companies and all that.
The patients are the joy.
Exactly.
Your patients become like your family and you see all generations of them.
Right.
And that's what I love about dermatology, guys. I'll see a grandmother for a skin cancer, her daughter, the mom for, Botox and filler, and then I'll see the daughter for acne. So it's
There
so
we
fun.
go,
I mean,
right.
Shib, don't we have some places
We have so
4
many
generations?
yes, no,
We have
absolutely.
4
Yeah.
generations.
There's whole families that we get to see throughout the
Yes.
weeks, and it's just satisfying and to meet so many groups of people from all different types of backgrounds, and just getting to see regulars as well, just getting to
Yeah.
see them. And so
It's fun to see them get better.
sorry to kill the mood with asking, what's the worst thing? What are some of the like the better things of
I mean, the
dermatology?
best thing is a long-term patient care. Some people like to just take care of a problem and never see that person again.
Hmm.
That is not my personality. So if you are interested in having longitudinal relationships with patients and also their family members and friends, I highly recommend dermatology because you will see these patients through all their aspects of their life.
Hmm.
I've been in practice now in Roseville, 13 years. So I've seen my patients, who are like, 15 with
Right,
acne and now they're
right,
married and they have kids and their kids are coming in for baby eczema.
right.
It's so
Oh,
fun.
I can't imagine.
So
That's got to be the
fun.
most
And like my
satisfying.
patients who we found a melanoma on 20 years or 15 years ago now, and they're still alive and they thank
Hmm.
me for keeping them alive.
That's just an incredible and more fulfilling and satisfying aspect of, I think it's got to be about being a medical provider, just having that type of impact
Totally.
overall. But
And not to be braggy, I mean, how many gifts do we get a
we
day?
eat so many, so many. I think I've single-handedly gained 5 pounds from all the treats that we get, cupcakes, cookies, which I'm so thankful for.
People bring us so
Um,
much wonderful
but
things
yeah,
to think, and we're thankful for them because they
yeah,
give us the energy to keep
yeah,
going.
no, absolutely, absolutely. So going into just the more of the entrepreneurship and just overall starting a practice, is there any advice you can give to medical professionals that are wanting to take kind of the same path that you've taken, and want to open their own practice? Any advice that you can give to them?
My number one piece of advice is to work at several other practices before you open your own practice. Starting a practice right out of residency or fellowship, I mean, great. You will be successful because, there are very few
Mm-hmm.
dermatologists, but you will never see kind of the pluses and minuses of everyone else's practice. So
Right.
I love that I had the opportunity to work in New York, New Jersey, Minnesota, old people, young people. I took
Mm-hmm.
everything, and I really think that that has helped make me successful.
Absolutely.
Number two, make sure you have a supportive spouse. There are many, many
Mm-hmm.
days when I was here 7 a.m. to midnight, and somebody has to take care of the kids and make
Mm-hmm.
dinner and things like that. So
Right.
you want somebody who's supportive of you.
Absolutely. Absolutely.
Number three, surround yourself with the best people. My hiring strategy is do not hire for the job, hire the personality and the intellect. You will find a job for that
Yeah,
person.
absolutely. And for one, I don't know how you do it. I mean, I love every single person that I've gotten the chance to work with. I'm probably best friends with the majority of our staff here. And whatever the choosing process is, whatever the formula is, just keep it going because it works. It really does. I've met,
Everything gels.
it really does. It really does. Um, so the gap year program, right? Me coming out of undergrad, right? I was just fortunate enough that I had a friend who was working here at the time. I was fortunate enough that I had that connection. So this gap year program, it seems so profound and right, not a lot of, I feel like a not people my age, just getting done with their undergrad, probably had no idea what they were going to do for their gap year. But so why the gap year program? What made you want to begin that?
So I am the fortunate one with this gap year program. I am surrounded by motivated, caring people who want to take care of patients. So really, as we all know, there's a shortage of trained medical professionals, especially nurses, LPNs, all those types of things. So when I first started, there was nobody to help me with these patients. So I had some really motivated pre-medical and pre-PA students, and they learned so quickly, and more importantly, they care. So we've now cultivated this. We have a formal program. What's our acceptance rate? It's
It's
astronomical.
incredible. It's amazing.
And then once you guys get into PA school and medical school, you're at the top of your class, and then you can choose whatever specialty you want. So it's really mutually beneficial. And I think it's
Absolutely.
most beneficial to the patients because the patients get somebody who cares. They're not
Absolutely.
there. I mean, obviously you have to make a living, but you're not there. You're there because you want to be there.
Absolutely, absolutely. Well, thank you. Yeah, that's great advice, and overall, just an incredible way to establish your practice and help your patients. But going into just picking your brain a bit, because the people want to pick your brain, right? You're a doctor, you're an expert in your field.
Thank you.
What is your biggest tip for achieving nice, healthy skin?
Ooh, good healthy skin. So your skin is your largest organ. We all know that.
Yes.
Don't poo-poo it. It protects you against the environment. It keeps everything in. Number one thing, sunscreen. Don't smoke, and if you can handle it, do some retinoids, topical retinol.
There we go. You heard it here first, folks. If you're going to remember 3 things, it's those. All right. You heard it here first from Dr. Mohiba Tareen herself. Thank you so much for being here. Thank you so much for speaking with us today.
Honor to be here. Honor to have you in my life, Shihab.
Thank you. Likewise, Dr. Tareen. I'm Shihab Adam, and this is the Daily Dose of Derm.